Good morning. I'm glad to be here to share the insights in terms of the mental health. Thank you.
We're also pleased to have you. What are some of the major contributing factors to workplace mental distress and illnesses amongst employees?
The challenges have been becoming stronger in the last 2 years. Because of the COVID, it has brought in the mental health issues to the fore. So people are struggling, there's anxiety, there's depression, there's stress that has increased in the workplace. And we have seen that employers are struggling, and then even the organizations, they are struggling to cope with those challenges.
So you speak about COVID-19 presenting major challenges for the well-being of people around the world, the working force included. What has been the impact of the pandemic on employees in general, workplace morale, and those with pre-existing mental illness, and the impact of the pandemic on anxiety, depression, and stress amongst employees?
For the first time, in a long time, we usually talk about mental health where it's an individual that is going through challenges, and then we rally around the individual and support them. But what the pandemic has done, it made it a collective, thing that everyone is going through it. So individuals, the teams, the family, everyone is going through the mental health. So the challenge is that in the workplace, it becomes even difficult because you're having challenges at home, you bring them to the workplace, and even in the workplace, those challenges, they are increasing. So that's why it has a big impact on the organization as well.
So research stats for both global and South Africa indicate that there's a heightened physical illness associated with stress, anxiety, and depression amongst employees. What's the impact of this on productivity and well-being of the workforce?
The productivity has been really impacted differently. So if we start with in the beginning, when the COVID started, it was really bad. And then when people started working remotely, they got used to that and they were able to take better care of themselves. So it reduced. And then later on, now people are going back to the office. So it's becoming too much again because people are struggling. They're not too sure how to deal with certain issues. So it's the productivity is affected, the morale is affected because some of the people have lost their jobs, and those who are remaining behind, they have the guilty conscience that they are left behind. Why? So it's a whole lot of things that are happening around us that are making it difficult, for individuals to cope with all the challenges.
Yeah, and the impact on the economy is a direct link of low affected productivity due to workplace mental illnesses. Do we have a measurement of this?
Yes, there is a clear impact because if the performance of the organization is affected, then which means the economy, we're not doing well economically. So that is a major problem because now there were a lot of companies that were forced to close doors, during that period. So obviously that affects the economy. There's a lot of unemployed people now who before they would benefit from the mental health issues that are in the workplace, the interventions in the workplace, but now they do not have access to those. So now it's becoming more and more difficult, for people to cope in general.
Our conversation thus far has been about the prevalent impacts. Let's talk a bit about the interventions that are being put in place, whether by the World Health Organization or by governments or by companies to address mental illness amongst the workforce.
The World Health Organization has provided clear, directives in terms of what needs to happen. And in South Africa, for example, our government has been in the forefront. There's policies, that guidelines that needs to be followed. And the organizations have taken that as well to come up with specific intervention. There's wellness interventions that most organizations are doing. And then those interventions, they target the organization wide, they target the teams, and then they target the individuals. The challenge is those people who are not in organizations, they don't have access, to those mental health interventions that are there in the workplace. So your counseling is there, the team debriefing, So there's a whole lot of things that we can do within the organization to allow the individuals to deal with the mental health issues.
So as much as we're openly talking about mental health in recent days, there is some level of stigma to people, especially people who are perceived to be in leadership or are perceived to be strong. They kind of a bit wary to speak out about their challenges with mental health. What are we doing? What advancements are there in the area of stigma around mental health?
Yes, the stigma is real, because if you are in an organization, like I see with some of my clients, within the HR Consulting, we do counseling, we talk to clients. And then in those instances, the clients, they will indicate that I'm not too sure. What will my organization say if they find out that I have depression, if they find out that I have anxiety? So the stigma is still there, and it is a challenge because now people can't openly get the necessary treatment that they want. So most organizations, they're actually now emphasizing that people need to go and do those wellness interventions so that they can help them to become better and cope with the challenges that they are facing.
So perhaps we have an opportunity now just to speak to our viewers just in terms of the benefits of undergoing treatment for mental health and what types of treatments exist.
Mental health, it's a big challenge, and then it goes with mental health. It affects everyone. So it's not something to be ashamed of, and seeking help is the first thing that people need to acknowledge that they have a challenge, and then they come and get assistance. So we do offer counseling sessions, for example, and then in certain instances, we do team interventions because you'll find that there's a need for coaching, there's a need for assessment. So those are the kind of things that we'll do to help people. But the biggest thing is that people need to understand that it's a strength. When you seek for help, it's not a sign of weakness. In the past, people will say, no, don't ask for help, especially when I also extend it to both genders, male and female. It's no longer an issue where it's only one gender that has to go and seek help, but both genders need to go and seek help so that they can be able to be assisted and to lead purposeful and meaningful lives.